Insulin is a small protein that is synthesized by beta cells of pancreas. Insulin causes rapid uptake, storage, and use of glucose by almost all tissues of the body, but especially by the muscles, adipose tissues, and liver. Insulin inhibits the action of hormone-sensitive lipase, due to which release of fatty acids from the adipose tissue into the circulating blood is inhibited. So insulin helps to promote fat synthesis and storage. Diabetes mellitus is a syndrome of impaired carbohydrate, fat, and protein metabolism caused by either lack of insulin secretion or decreased sensitivity of the tissues to insulin. There are two general types of diabetes mellitus. Type 1 diabetes, also called insulin-dependent diabetes mellitus, is caused by a lack of insulin secretion. Type 2 diabetes, also called non-insulin dependent diabetes mellitus, is initially caused by decreased sensitivity of target tissues to the metabolic effect of insulin. The basic effect of insulin deficiency or insulin resistance on glucose metabolism is to prevent the efficient uptake and utilization of glucose by most cells of the body except those of the brain. As a result, blood glucose concentration increases and utilization of fats and protein increases. Destruction of beta cells in many patients with type 1 diabetes is due to injury to beta cell, disease that impair insulin production, viral infection, autoimmune disorder, heredity. High levels of blood glucose cause more glucose to filter into the renal tubules than can be reabsorbed, and the excess glucose spills into the urine. The very high levels of blood glucose can cause severe cell dehydration throughout the body. This dehydration occurs partially because glucose does not diffuse easily through the pores of the cell membrane, and the increased osmotic pressure in extracellular fluids causes osmotic transfer of water out of the cells. When blood glucose is poorly controlled over long periods in diabetes mellitus, blood vessels in multiple tissues throughout the body begin to function abnormally and undergo structural changes that result in inadequate blood supply to the tissues. The shift from carbohydrate to fat metabolism in diabetes increases the release of keto acids such as acetoacetic acids and beta-hydroxybutyric acid into the plasma more rapidly than they can be taken up and oxidized by the tissue cell. As a result, metabolic acidosis develops from the excess keto acids. Failure to use glucose for energy leads to increased utilization and decreased storage of proteins and fat. Therefore, a person with severe untreated diabetes mellitus experiences rapid weight loss and asthenia. In contrast to type 1 diabetes, type 2 diabetes is associated with increased plasma insulin concentration. Hyperinsulinemia occurs as a compensatory response by the pancreatic beta cells for insulin resistance, a diminished sensitivity of target tissue to the metabolic effects of the insulin. The decrease in insulin sensitivity impairs carbohydrate utilization and storage, raising blood glucose and stimulating a compensatory increase in insulin secretion. Some studies suggest that obese subjects have fewer insulin receptors, especially in the skeletal muscle, liver, and adipose tissue. However, most of the insulin resistance appears to be caused by abnormalities of the signaling pathways that link receptor activation with multiple cellular effect. Metabolic syndrome are closely related to accumulation of excess adipose tissue in the abdominal cavity around the visceral organs that lead to impaired insulin signaling. Excess formation of glucocorticoids or excess formation of growth hormones also decreases the sensitivity of various tissues to metabolic effect of insulin and can lead to development of diabetes mellitus. With prolonged and severe insulin resistance, even the increased levels of insulin are not sufficient to maintain normal glucose regulation. In some people, however, the pancreas gradually becomes exhausted from secreting large amounts of insulin, and apparently some other people produces enough insulin to prevent severe abnormalities of glucose metabolism. Some studies suggest that genetic factors play an important role in determining whether an individual pancreas can sustain the high output of insulin over many years. Effective treatment of type 1 diabetes mellitus requires administration of enough insulin so that the patient will have carbohydrate, fat, and protein metabolism that is as normal as possible. In person with type 2 diabetes, dieting and exercise are usually recommended in an attempt to induce weight loss and reverse the insulin resistance. If this strategy fails, drugs may be administered to increase insulin sensitivity.